Seven, the privilege hour, and the privilege hour to be rendered by Councilor Tina. You may proceed now, Mr.
Thank you, Madam Presiding Officer. The Honorable Presiding Officer and member of the Committee on Rules, the Honorable Dailin Tornea Hufiganya, to the distinguished members and colleagues of the SANGGUNIANG PANLUNGSOD Victoria City, to my fellow Victoriasanon, ladies and gentlemen, good morning to everyone, or good morning. I rise today in my capacity as Vice Chairperson of the Victoria City STI HIV AIDS Council and as Chairman of the Committee on Public Health to report on the present situation of STI, HIV, and AIDS in Victoria City and to seek your support for legislative measures that will protect the welfare of our fellow Victoriasanons living with this condition. AIDS was first discovered in the 1980s and reached Manila by 1984. By 1994, the first case was recorded in Negros, and by 2001, Victoria City itself had its first documented case. And by 2002, the city's first AIDS death was recorded. Since then, we have witnessed a steady rise in numbers nationwide and in our locality. At present, Victoria has a rising record below 100 cases of HIV, but with 14 deaths since 2002. While this number places us 8th among LGUs in the province with the highest recorded cases, we must also recognize that this reflects not only the prevalence of the disease, but also the effectiveness of our active programs and the willingness of our people to seek testing and treatment. The most common age group affected in Victoria is 15 to 39 years old, spanning our urban, rural, coastal, and in the industrial communities. In short, all areas have been penetrated. The main mode of transmission remains sexual contact, but needle infections and true breastfeeding are also important factors to consider. It is important to stress HIV does not discriminate. While the LGBTQIA plus community remains among the most vulnerable, we have also documented cases among heterosexual men and women and other members of the society. Today, Victoria City aligns its local goals with the DOH 8-point agenda, namely, number 1, intensify HIV information, education, and communications campaign. Number 2, increase testing. Number 3, increase treatment coverage. Number 4, increase the number of virally suppressed and ensure availability of HIV communities and quality service. Capacitate people living with HIV. Strengthen collaboration with civil society and support groups. And finally, harness innovative technology in prevention and care. Our local vision is to reach at least 85% of those infected, ensuring that of the 85%, another 85% receive antiretroviral therapy or ART, and another 85% of those on ART achieve viral suppression. But colleagues, we face many challenges. First, nutrition and sustainable support. A person living with HIV can live a long, healthy life, but only if treatment is sustained and supported by proper nutrition. To complement ART, we propose a nutrition enhancement and support program that will provide regular, monthly, or quarterly nutritional packages, vitamin C, vitamin B complex, milk, rice, and basic groceries. Second, beyond providing medical and nutritional care, this ordinance affirms our duty to uplift the dignity of persons living with HIV by opening doors to livelihood and skills opportunities so that they may not only survive but truly thrive as empowered, self-reliant, and productive members of our community. Third, testing and equipment. Every 6 months, patients must undergo a CD4 test which monitors the immune system. Currently, we lack our own equipment. A CD4 machine costs about 2 million pesos, a necessary investment that could help save lives. Another vital test is the viral load test, which measures the level of HIV in the body. These are available only in treatment hubs outside Victoria's, limiting access. Fourth, and perhaps most painful, is stigma and discrimination. HIV will not kill you, but stigma will. Too many of our fellow Victoriasanons face rejection, isolation, or ridicule. Yet science is clear. HIV is not airborne. It cannot be transmitted by talking, shaking hands, or sharing meals. Only four body fluids are risky, namely blood, semen, vaginal secretions, and breast milk. To be HIV positive is not a death sentence. The very first person diagnosed in Negros in 1994 is still alive and thriving today because of proper treatment and community support. Our efforts are anchored on sound legal and policy framework. 1987 Philippine Constitution, Article 2, Sections 10, 15, and 25 uphold the dignity of every human person, respect for human rights, and the promotion of public health. Republic Act 8504 or the Philippines AIDS Prevention and Control Act of 1998. Republic Act 11166, Philippine HIV and AIDS Policy Act of 2018 mandating a human rights-based approach. City Ordinance Number 09-2017 of the City of Victorias, creating the Victorias City Local STI HIV AIDS Council. Executive Orders Number 07 of 2013, Number 14, Series of 2017, and Number 11, Series of 2023, successively reconstituting and strengthening the Council. This underscored that the fight against HIV/AIDS is not just a health issue, it is a human rights issue. In this light, I humbly present for your support the proposed ordinance entitled An Ordinance Establishing the Barangay, STI, HIV, and AIDS Council in every barangay of Victoria City as the official barangay arm of the Victoria City STI, HIV, AIDS Council, mandating the organization of a barangay LGBTQIA organizations as a core partner of the council, designating the Sangguniang Barangay Committee on Public Health Chairperson and the existing barangay health worker focal person for STI, HIV/AIDS as co-focal persons, introducing a nutrition enhancement and support program for persons living with HIV and providing a framework for prevention, care, support, and the elimination of stigma and discrimination in close coordination with the Victoria City STI, HIV, AIDS Council, and the City Health Office. This measure localizes the fight, bringing prevention, care, and support directly to the barangays where stigma can be broken and compassion can be lived out. Colleagues, the numbers tell us we cannot be complacent. The stories of courage from those living with HIV remind us of our shared humanity, and the laws and policies of our republic call upon us to act. Let us not allow stigma and silence to undo the progress we have made. Let us support this ordinance not just as lawmakers, but as protectors of the health and dignity of every Victoriasanon. HIV is not a curse. It is a medical condition, one that can be managed with the right treatment, support, and love. Together, We can build a victorious where no one is left behind, where being positive does not mean losing hope, and where compassion is stronger than discrimination. Madamo gid nga salamat, and may this council stand united for health, dignity, and life. Good morning, everyone.
Thank you, Councilor Martino Acuña. Before we proceed, I would like to acknowledge